The question health officials are working to answer right now is who should get the COVID-19 vaccine first. The Marshall Project, a nonprofit news organization that reports on criminal justice issues, is looking at whether or not prisoners should be in that first group. In their piece, should prisoners get COVID-19 vaccines early? Jamiles Lartey, staff writer at the Marshall Project, co-wrote the article. He's with us now to talk about it. Thanks so much for being with us. So your research found at least 6 states have put incarcerated people in the first group to receive the vaccine. Others have them in phase 2. Explain to our viewers the strategy behind vaccinating this population early.
Absolutely. So incarcerated people, of course, live in congregate living settings. They have a high rate of underlying conditions that predispose them to bad outcomes with the virus. And if you really think about it, right, so much of managing this pandemic has been relying on people, individuals, to make smart decisions, right? Sacrificing social time, visits with family, and staying home, right? You're safer at home. Well, those are choices that incarcerated people aren't really free to make in the living setting that they're in. So they just have a high threshold of bad outcomes from the virus, and they don't have a lot of opportunities to make other choices.
Jamal, I would think also that, those who actually work in the prisons would be amongst the first to get the vaccine because of what you just pointed out. I mean, the people in the prisons, those who are incarcerated, they can't go anywhere. So it's the people coming in and out of the prison, I would think, are actually sort of part of the problem when it comes to containing the virus. They're the ones that are leaving and then coming back possibly with the virus, right?
That's correct. So correctional officers have very correctly also been tabbed as one of the first groups to receive the coronavirus vaccine. And it's for the obvious reason that you point out. They are simultaneously exposed to a lot of the same conditions that I just described that inmates are in. And also, they're the primary vector for the disease to travel between the prison setting and the general population setting.
Now, you mentioned also that prisoners are more susceptible to this virus because they're more likely to have comorbidities. Why is that?
So it's largely due to the substandard primary medical care that people receive over long stays in prison. It's also true that our prison population is much older now than it was a short time ago. And though it's still a little bit younger than the general public, those senior incarcerated people are really sitting ducks based on the way we know this virus attacks older people living in congregate settings.
Jamiles, so I guess the question that a lot of people are going to have is when you look at the incarcerated population and the people who are looking out for them, is there a point on the horizon where they will be able to get these vaccines? I mean, is anybody specifically who's responsible for this making that point, or is it still up for discussion?
Well, the CDC has told states that they need to consider incarcerated people as they make their plans for vaccine distribution. The CDC has also asked states to approach the rollout of the vaccine from a health equity point of view, which is to say, from the point of view that we should be trying to equalize outcomes, and that people who are more likely to have a worse experience should be prioritized. So that's who's responsible. The individual states, the CDC has put that into play. The individual states are responsible for figuring out how they're going to organize it. They've all submitted their plans now to the CDC. We've seen that while a handful put incarcerated people in phase 1, many more put them in phase 2, and a handful of states haven't really been exactly clear about where incarcerated people are going to fall.
Got it.
So here's the question. There's an awful lot of people in the general population that are uncomfortable with this vaccine. What if incarcerated people say, no, I don't want it? I mean, do they have that choice? I don't even know, if they can say yes or no. Maybe you've seen sort of other situations with vaccines within the population, but do they have a choice to say no?
Yes, they absolutely, by law, do have a choice. There's no mandatory vaccinations. There are rumors that we've heard about, that there may be a possibility that some people will not want to get it. In our reporting, that's not something we found. The incarcerated people we talked to for the story were mostly ready to take it or had already contracted and recovered from the virus. It's certainly something to watch going forward, but I would say at this point, there's no reason to believe that incarcerated people will be any more or less susceptible to anti-vax conspiracy theories than the general public. In fact, if anything, one of my colleagues pointed out, I think a good point that, to the extent that a lot of anti-vaccination conspiracy theories are based around the notion of, this is the government's tool to control us. Incarcerated people are already under state control. It's not so much of an abstract concern for them. So I think they don't need to make up ways to think about the government trying to control them.
Totally. Well, Jamiles Lartey, I'm really glad that you were here to talk about this portion of the population. There's been, obviously a lot of concern about elderly people in nursing homes. They're in a contained environment, but our prison population, they're under very similar restrictions as well. And we don't talk a lot about prisoners because people go, why'd you end up in jail? Maybe you deserve to be there, right? So it's good that we're having this discussion now because it impacts all of us. Jamiles Lartey, thank you so much.
Thanks for having me.